Hi, I'm Josh, and welcome to a quick intro into proton beam therapy.
Proton beam therapy is an advanced form of radiotherapy, which instead of using X-rays like traditional forms, uses high-energy beams of protons to target cancer cells and tumor sites. Due to the fact that proton beams are much more precise than X-rays, the healthy tissue around the tumor is less affected. The image to the right shows a barium probe beam gantry, which is used to carry out this form of therapy in the University College Hospital. Why is this form of therapy important? It is important due to the fact that protons are able to deliver energy in a Bragg peak. A Bragg peak is a phenomenon in which charged particles are able to deliver energy in a large peak before coming to a stop, which can be seen in the graph to the left. It shows that the protons are able to deliver the majority of their energy right before immediately coming to a stop, which is very beneficial for this type of treatment of tumours near vital organs and sensitive areas such as the brainstem and other vital parts of the nervous system. This is also beneficial in treatments of young children and babies, as it reduces the amount of radiation that growing organs and growing healthy tissue experiences. Some of the pros of proton beam therapy are that it is much more precise than forms of traditional radiotherapy, which I've said before, and due to the fact that there is no exit dose, the risk for secondary cancers are much lower than traditional forms of radiotherapy. Due to the two benefits above, the quality of life of patients during and after the treatment is much higher, as they will not experience as many of the negative side effects of radiotherapy. However, there are some drawbacks to this form of therapy, one of which is the very limited access to the equipment required, as a facility in the University College Hospital can only treat up to 650 people annually, and is one of two facilities in the entirety of the UK. The equipment is also very expensive, as a facility in the UCL hospital required around £350 million in funding. The staff that use this equipment also requires specialised training, so it will be difficult to implement globally in areas which lack doctors already. One challenge I decided to link it to was mental health and well-being, due to the fact that the mental health of many cancer patients are heavily linked to the amount of fatigue, cognitive decline, and pain they experience during treatment, which is heavily influenced by the amount of damaged healthy tissues experienced during the treatment. And due to the fact that proton beam therapy reduces the amount of radiation experienced by healthy tissues, this would reduce the amount of pain and suffering of the patients, which would in turn affect their mental health positively. The quality of life of patients during and after the treatment is better due to the less stressful procedure,